ICPC. ICPC stands for International Classification of Primary Care. Introduction. International Classification of Primary Care, or ICPC, classifies patient data and clinical activity in the domains of general or family practice and primary care, taking into account the frequency distribution of problem scenes in these domains. It allows classification of the patient's reason for encounter, or RFE, the problems or diagnosis managed, interventions, and the ordering of this data in an episode of care structure. Applicability of the classification. ICPC was designed for the collection and analysis of patient data and clinical activity in the domains of general or family practice and primary care. This collection and analysis can occur at the level of an individual patient for clinical care, at the practice level for recall, clinical audit, and activity analysis, and at the regional, state, and national level for health services, research, and statistics. It can be used to classify terminologies and other classifications in electronic health records to facilitate decision support and patient safety systems. ICPC is available in 19 languages: Catalan, Chinese, Croatian, Danish, Dutch, English, Finnish, French, German, Greek, Italian, Japanese, Norwegian, Portuguese, Romanian, Russian, Serbian, Slovenian, and Spanish. History. ICPC started in mid-1970s. Most morbidity data collected in primary care settings for statistics and research was classified using the International Classification of Diseases, or the ICD. In 1972, the Classification Committee of the World Organization for National Colleges, Academies, and Academic Associations of General Practitioners or Family Doctors, or WONCA, first met in Melbourne at the time of the inauguration of WONCA. In 1975, the WONCA Classification Committee, now the WONCA International Classification Committee, or the WICC, designed the International Classification of Health Problems in Primary Care, or the Icpc. In 1979, Icpc second edition was published related to the 9th revision of ICD. In 1983, third edition of the ICHPPC2 defined was published. In 1987, first edition of ICPC was published by WONCA. In 1993, a project began in 1985 to test the usefulness of the new classification system in producing morbidity data from general practice for national health information systems. This involved translations of the classification and comparative studies countries. The results were published in 1993 in a book including an update of the ICPC. In 1998, WONCA published a revised version of the ICPC, or the ICPC2, with inclusion and exclusion criteria attached to the classification rubrics and a mapping to ICD-10. The year 2000, a revised electronic version was released. In 2003, World Health Organization recognized ICPC2 as a WHO-related classification for the recording of data in primary care. Technical qualities of ICPC. ICPC is a biaxial structure with 17 chapters on one axis and 7 components on the other. Chapters are based on body systems, with an additional chapter for psychological problems and one for social problems. Each chapter is divided into 7 components, identified by a range of 2-digit numeric codes which are not always uniform across chapters. Component 1 provides rubrics for symptoms and complaints. Component 7 is a diagnosis or disease component in each chapter. Components 1 and 7 in Icpc function independently in each chapter and either can be used to code patient RFEs, presenting symptoms, and diagnosis or problems managed. Components 2 to 6 are common throughout all chapters, each rubric being equally applied to any body system. Component 2 covers diagnostic screening and prevention. It is useful when there is no underlying pathology for the problem under advice and health instruction. Component 3 treatment, procedures, and medication. These components should rarely, if ever, be used to describe a problem under management as it covers the processes involved in patient care. Components 2 and 3 are based broadly on the ICD-9 procedures in medicine and are heavily influenced by international classification of process in primary care. Component 4, the test results, and Component 5, administrative, provide somewhere to put those difficult problem labels which frequently have no pathology. The chapters: A for general and unspecified, B for blood, blood-forming organs and immune mechanisms, B for digestive, F for eye, H for ear, K cardiovascular, L musculoskeletal, N neurological, P psychological, R respiratory, S skin, P metabolic or endocrine and nutritional, U urological, W pregnancy, childbearing and family planning, X female genital, Y male genital, and Z social. This picture shows the complete coding of the Icpc. Gray-colored are for process codes, green for symptoms and complaints, yellow for infections, blue for neoplasms, red for injuries, violet for congenital anomalies, and indigo for other diagnoses. Ownership and support arrangements. The International Classification of Primary Care is copyright property of the World Organization of Family Doctors, or WONCA. WONCA is the International Incorporated Association of National Colleges, Academies, or organizations concerned with academic aspects of general or family practice. Icpc is supported internationally by the WONCA International Classification Committee. Local support is given by 2 collaborating centers of WONCA. The Australian Centre is a family medicine research center at the University of Sydney. A European center is based in the Department of General Practice at the University of Amsterdam. Update processes. Icpc is maintained and updated by the International Classification Committee of WONCA. The full revision cycle is currently 11 years. However, mapping to other classifications may be reviewed at shorter intervals to adjust for changes in other classifications and change usage. WICC has been active since 1972 and currently has 40 members from 23 different countries. WICC is partially funded by WONCA, and the participation of some members is supported by their national governments. Accessibility. ICPC is available in both written and electronic form. ICPC is available in book form from Oxford University Press or the OUP on a print-on-demand basis. Electronic versions are available from the OUP website for personal use. Commercial or national use requires a formal license from WONCA. In the first instance, the regional members of the WICC should be contacted for advice regarding licenses. That's all. Thank you.